In this video, we'll discuss pre-authorization and its impact on patients. Pre-authorization requires that certain medical services, treatments, or prescriptions be submitted to the insurer for review and deemed medically necessary before the treatment will be covered by the health plan. This policy also goes by the names prior authorization, prior approval, and pre-certification, and is used by insurers to control healthcare costs. But these requirements can be daunting to a patient who is already overwhelmed by cancer or dealing with another serious illness. What you may not know is the process is also daunting for physicians. Pre-authorization can require repeated and lengthy phone calls, appeals, and explanations to the insurer, followed by a non-transparent decision-making process that can take days, weeks, or months. And sad to say, the decisions are often made by healthcare professionals who lack expertise in the patient's illness and/or treatment options. Studies have shown that delays in receiving specialty care increase the likelihood of poor outcomes for cancer patients. In the following story, you will learn how one patient was affected by pre-authorization and how it impacted their health.
I was in my 30s when I was diagnosed with multiple myeloma. Multiple myeloma is a cancer of the bone and bone marrow. Prior authorization and other insurance policies and procedures, they cause delays in getting the medications that I need to battle my cancer. Earlier this spring, one of the scariest times I've had in dealing with prior authorization and insurance policies. By the time I got a medication to try to hold back my cancer, from the day it was prescribed to the day I got it was almost a month. My cancer advanced so much. I would be in a better state now if I hadn't gotten so sick by that delay. But I know plenty of stories where people have died from that kind of delay. If I were in the room or able to talk to an insurance company executive or a PBM manager, I would want them to think about what they would be doing if their family, friends, or loved ones had to live through these insurance processes like prior authorization. They take so much time, energy, and frustration, and ultimately the delays caused by these policies take time away from their loved ones that they could be living.
To protect your valued employees, here are some recommendations to ease the burden of pre-authorization. Don't require pre-authorization for first-line therapies, generics, drugs approved 90% of the time, and drugs without alternatives for a particular disease. Don't require new pre-authorizations for a patient who is stable on a particular drug. Waive pre-authorizations for trusted clinicians and set clear time limits so pre-authorizations are decided swiftly. If the plan fails to meet deadlines, pre-authorization should be automatically approved. To learn more about how utilization management can affect patients, please refer to the booklet Best Practices for Prescription Drug Benefit Design, available at cancercare.org, and view the other videos in this series.